Medicaid Waivers for Children in Colorado, presented by Advocacy Denver. This information is up to date as of April 10th, 2023. Medicaid waivers are designed as an extra benefit for individuals with disabilities. The waiver system was created to keep individuals with disabilities in their homes and out of institutions. Children's waivers do not count household income. They are based on diagnosis and only the child's income and assets count. So when filling out the application, it is important to remember not to count the family income. There are 4 waivers for children in Colorado, each with their own qualifications and services. In the next few slides, we will address each of the waivers. In conjunction with Medicaid, waivers offer the ability for family members to be paid as caregivers for their children. This benefit can be life-altering for many families who struggle to find care for their high-needs children or who cannot work outside of the home. The Children's Extensive Support Waiver, CES, is the most comprehensive waiver, but does require a high level of care. It is designed to provide Health First Colorado benefits in the home or community for children with developmental disabilities or delays that are in the most need due to the severity of their disability. Children must meet additional targeted criteria. Keep in mind, the CES waiver requires an intervention every 2 to 3 hours, including overnight. Children with IDD may not qualify for this based solely on diagnosis. A service plan will be developed with your service coordinator from the Community-Centered Board. As you can see, there are a wide variety of benefits offered through the waiver on top of Medicaid services. Currently, a family member residing in the child's home can be paid as a licensed certified nursing assistant or private duty nurse in conjunction with these services through the regular Medicaid benefit. Additionally, a child on the CES waiver can transition and bypass the state wait list right onto the Developmental Disability DD adult waiver at age 18. The Children's Home and Community-Based Services Waiver, or CHCBS, was created to provide Health First Colorado benefits in the home or community for children who would otherwise be ineligible for services due to excess parental income and/or resources. Children must be at risk of nursing facility or hospital placement. Think of this waiver option as one for children with an intense medical need who, without natural supports like their family, would reside in a hospital or skilled nursing facility. The only 2 services offered beyond the regular Medicaid benefit in this waiver are case management and in-home service supports, or IHSS. Your child can still receive in-home clinical therapy services through Medicaid. IHSS allows you to direct and manage the unlicensed attendants who provide personal care, homemaker, and health maintenance services with the support of an agency. Through IHSS, you are empowered to select, train, and manage attendants of your choice to best fit your family's unique needs. Family members who reside with the patient are also allowed to work and bill as IHSS providers in their own home. The Children with Life-Limiting Illness (CLII) waiver was designed to quickly get children with life-limiting conditions services. Approval process for this waiver moves very quickly with the correct documentation from a physician. It allows the family to seek curative treatment while the child is receiving palliative or hospice care. To be enrolled in this waiver, you must utilize one of these benefits listed here. Families still utilize regular Medicaid benefits and can work in their home as a certified nursing assistant or private duty nurse based on the plan of care. The Children's Habilitation Residential Program Waiver, or CHIRP, provides Health First Colorado benefits in the home or community for children and youth who have an intellectual or developmental disability and extraordinary needs. Children and youth ages 0 to 20 years who have an intellectual or developmental disability and intensive behavioral or medical support needs that put them at risk for out-of-home placement qualify for this waiver. When they age out, young adults on this waiver can bypass the state waitlist for the adult DD waiver. Services with the CHIRP waiver allow a patient to live and thrive within their community while supporting family members. Residential 24-hour supports are similar to those offered on the adult DD waiver. This waiver can help a child transition out of a facility and back into their home, as well as work as a support system to prevent admission to a facility. Having a documented diagnosis is not always necessary because documented delays may suffice. However, the more documentation you have to offer, the better your chances of a quick approval. Once approved, you may need further evaluation and documentation to receive specific services. Some children may not qualify for a specific waiver based on eligibility requirements. However, they may qualify for family support services based on these eligibility requirements. FSS does not grant access to the regular Medicaid benefit, but some families may qualify to buy into that benefit. Rocky Mountain Human Services serves as both the SEP and CCB for Denver County. At the websites listed in the slide, you can find the county's SEPs and CCBs for the rest of Colorado. The key to a timely processing of applications is providing all documents. For waivers or services requiring a developmental disability, please note that both a neurological diagnosis and adaptive or IQ testing under 70 are required. If no diagnosis is present, a letter from a physician can be submitted stating that all efforts to obtain a diagnosis have been made and the condition is neurological.